I think residency is all about learning and gaining experience, so that eagerness to learn and willingness to take on the work and really put in the time and effort to do that work. We have a lot of preceptors and we're very direct patient care focused. So being a team player on our team of pharmacists and other disciplines, and also being really empathetic with patients and having good people skills in general. And just being good problem solvers, because we encounter all sorts of things all day long.
Sure. The most successful have been those growers. So it's not about being right. It's just about that you're willing to go from the beginning of the year to the end of the year and continue growing as an individual in your pharmacy practice. I think a lot of residents come in, you're coming out of this student mode of, I need to have the right answer and the right dose and the right thing for the patient. And it's not always black and white. And so individuals that are able to live in this gray area and realize there's more to pharmacy besides the right answer. Sometimes it's about the development of relationships. Sometimes it's about administrative tasks, helping the admin team put together pharmacy week. There's all these other factors that actually show a great deal of responsibility and balance in somebody's life. And so when a resident is just solely focused on their clinical rotations and they can't help out a co-resident, they can't take on responsibilities or go to a meeting for somebody else, and because they don't have that flexibility or that gray area, those are things where there's pitfalls in the residents, or they struggle, and I think they just don't enjoy the year,
Having a little grit, being able to make it through the year, and it's a grind of a year. Keeping positive, staying positive throughout the year, and finding ways to keep it fun and light, because it's a lot of hours. So I would say that's one thing we really try to look for in a candidate is this person are they going to burn out? Are they going to really be prepared for the amount of time commitment it is? I wouldn't say that every one of our residents has had all of that, but we do strive for that.
I think having them be as personable as possible is really important to me. I want somebody who can interact with both me as a director and the preceptors, but also with the staff. Again, I want their year to be really positive here, and so I want them to be able to really fit in. They have to be confident in their knowledge base and really feel like they can speak to certain nuances of pharmacy practice in a confident way, and also kind of get excited about it. And then also they have to have a clear reason to wanting to do a residency, how the residency is going to help move them forward in their career of the place they really want to be. Because those core values within the resident is going to make them successful. Those are the things that they're going to, on the darkest days of the residency, they're going to be able to pull from and say, this is why I want to do this. This is why I'm doing this. And I know I have to do this to be able to get to X, Y, or Z.
They can all be so different. And at the same time, I think there is probably some commonality. We have a very high retention rate for our past residents getting hired on here as well. And I think, common characteristics would be, we talk about this during the interview process too. We are looking for people with really actually positive attitudes and people who are teachable. You don't have to be someone that has the strongest clinical skills. That's not what's going to make you the strongest resident. Because if you're teachable, then you can progress and you can grow. You accept constructive feedback and you develop yourself and grow professionally from that, where someone that, might have a great clinical knowledge but can get very defensive when it comes to feedback, then that's not as conducive of a learning environment and kind of makes it not as positive of an environment either for the preceptor or the resident. And so I think that's what have made our residents successful in our program, is just having that positive attitude and being able to make the residency experience a positive one, rather than kind of focusing on the negatives, like how busy they are and how many projects they have, etc.